Hi guys, it's Dr. Simpson with Stem Cells for Dogs, and I wanted to go over today the difference between autologous stem cell therapy and the HUC-DT therapy that we've been using. Basically, when you're looking at the therapies, we're both using stem cells to help to speed up the regeneration process and help to decrease inflammation, decrease pain, and overall give a better result in multimodal therapy for our pets. When we look back at autologous stem cell therapy, how autologous stem cell therapy kind of came about, and it really was one of the first original stem cell therapies used in dogs. Basically, since the early 2000s is when it started in clinic use. And at that point in time, you would take a dog and you'd either harvest bone marrow or fat, fat being the most recent usage of the autologous therapy. And from those samples, you would take it and you'd be able to pull out stem cells, because stem cells live typically kind of on the outside of the capillary beds and the vasculature. So you would harvest these cells. The animal had to be put under anesthesia, so you would take the cells through almost like a bone marrow aspirate or a fat harvesting technique, kind of like a liposuction in a way. And those samples were then taken, sent to a lab to where they were reactivated or chemically cultured in lab. The stem cells were harvested from that. They were sent back to the veterinarian. The animals typically put under anesthesia again, so that way you could make sure that you got the injections where they needed to be. And then the infusion was done into your pet. Well, it worked great. Very effective. A lot of patients have had great results with that. The downsides of the autologous therapy, though, where typically you had 2 anesthetic episodes. And when you're dealing especially with a pet that's older, anesthesia comes with a lot of risk. And so you're putting your pet under risk twice to harvest the cells. 2, you normally would have a painful procedure. I mean, when you think about bone marrow aspirates or taking bone marrow samples, or you think about liposuction in humans, it hurts. I mean, it is something that's painful. So you have a procedure the pet has to also recover from. So you have an animal that's already has some sort of a ailment, having to recover from a procedure, and then having to go under anesthesia again to get an infusion. The results were great. I mean, it really works well. The downside of it, though, not only with the anesthesia and the surgery, but also dogs that are older, their stem cells aren't quite as active as they used to be. So you're having a kind of a product that may not work quite as well. And normally within a sample, initially early on, they were getting about 1,000 ml cells per ml or so. And so the cell count was pretty low. But the therapy worked really well. And that's really what was done for decades, really, in the stem cell world for dogs. Also, the downside of this was that there's quite a bit of cost associated with that, because the anesthetic and the doctor time and the surgery and everything else. So you might be anywhere between the $4,000 to $10,000 range, depending on where it was done and what they were doing, just to get the cells and have your infusions. With HUC-DT, where we're using the human umbilical cord stem cells, these stem cells basically come from, donated from mothers, and they are then used into medical research and into the medicine fields. And these cells basically come in a very high concentration. So while with autologous therapy, we had basically 1,000 cells per ml. With the HUC-DT, we have 5 million cells per ml. So we have a much higher volume. With that also comes the ability to hopefully regenerate a little bit faster or stimulate more anti-inflammatory effects, because the cells are young, they're healthy, they're happy, they're just taken from the umbilical cord, so they're fresh. The other thing that we also see as a benefit, and one of the major differences with the HUC-DT, is that these cells can be infused through just a straight joint injection or through IV usage. And that means there's no anesthetic, there's no surgery, there's no painful procedure. The worst part about it is putting a catheter in, which we do every day in animals. So this is something that's not painful. It doesn't require risky anesthesia. It doesn't require large amounts of time. The procedure typically takes about 15 minutes, and your pet can be infused right there while you sit and wait with them. And that also decreases stress, which is huge. And because of that decrease in time that it takes and the decrease in anesthesia, the cost difference is quite remarkable. You're looking at a procedure with the HUC-DT closer to the $2,000 to maybe $3,000 mark, depending on how many mLs and how many cells and what you're doing, versus the old autologous therapy, which was sometimes even double to triple that, depending on what you were doing. So overall, those are some of the major differences that we see with the autologous versus the HUC-DT cells that we're now using with stem cells for dogs. So stay put for more information, and we'll go from there. Thank you, guys.